Welcome to a video of the Thoracic Surgery Residents Association, or TSRA. The mission of the TSRA is to represent the interests of all residents training in cardiothoracic surgery. To that end, many educational resources have been created through the TSRA for residents by residents, the newest of which we will be highlighting in this video today, the TSRA Clinical Scenarios in Cardiothoracic Surgery, 2nd edition. My name is Jessica Luke, and I'm a cardiovascular surgery resident at the University of British Columbia in Vancouver, Canada. I am joined today with the editors of this new book. Can you all please introduce yourselves?
Hi, I'm Justin Watson, Cardiothoracic Surgery Fellow, OHSU, Portland, Oregon, and thank you for having me.
Hi, I'm Clauden Louis. I'm a PGY5 at University of Rochester, Integrated Cardiothoracic Surgery. Thank you for having me as well.
Thank you so much for joining us. We will be discussing this phenomenal new resources for cardiothoracic surgery residents. We'll start this discussion off with a question for Dr. Watson. Can you share with us the premise behind this book and how cardiothoracic surgery trainees can utilize this resource?
Definitely. I think that's an excellent question. I think cardiothoracic surgery training can be focused on two main pillars. One, clinical decision-making, and two, technical ability. I think that over the last 20 or 30 years, the field of cardiothoracic surgery has grown exponentially, including many different operations performed today that were only dreamed of. I think that that is a good thing for us as surgery trainees, but I think it actually increases the amount of time spent in the operating room and subsequently decreases our ability to learn clinical competencies. The first edition of this book, published in 2013, aimed to augment this area and did an excellent job. We were able to look at 71 different chapters and go over different skills in that textbook. This time around, the current review aimed to update many of the areas of the field that had expanded in the last 5 to 10 years. Currently, the updated review text was edited by 159 different residents and faculty nationwide, and now includes 91 chapters, with 19 new chapters and 36 chapter revisions.
That's phenomenal. Thank you so much, Dr. Watson. And going on to a second question for Dr. Louis, what can we expect in this new edition of the TSRA Clinical Scenarios in Cardiothoracic Surgery book?
As Dr. Watson just previously alluded to, the prior edition of the TSRA Clinical Scenarios, which was published back in 2013, was tremendously successful. The first edition augmented a lot of content, both applicable for decision-making, as well as different clinical case scenarios. The aim of this review book, again, focusing on those high clinical scenarios, now has 19 additional chapters, 36 chapter revisions, and to specifically discuss some of the changes we've implemented on this most recent edition. The heart chapter, or the cardiac surgery chapter, has been supplemented by the additions of acute shock, durable mechanical circulatory support, a robust transplant chapter, discussions on pacemakers, a chapter dedicated on interventional catheterizations. The congenital section has been increased from 13 chapters to now 21. And the thoracic chapter, which by the way was pretty robust since 2013, its 30 chapters has now been completely updated, additional chapters added, and the NCCN guidelines have been updated. So we are essentially up to date in regards to the current guidelines and treatment managements up to today's date. So we're very excited about the new changes implemented on this most recent edition.
That's phenomenal. Thank you, Dr. Louis. Is it possible for you to give us a quick preview of the book?
Sure. All right. Well, I have it. So here's a preview of the clinical scenarios textbook here. The first page is an image of the first bilateral thoracotomy done at our institution with Dr. Gosef, who's also a senior chapter editor. the editorial staff here again. The foreword by Dr. Vaporsian, who's the current TSDA president, and the preface by the editorial staff. And here's the table of contents. The 91 chapters are present here, as you can see. Just to jump into one of the chapters, the new edition, for instance, chapter 65, durable support, mechanical circulatory support. This is one of the latest editions of the chapters, as mentioned previously, the clinical scenarios discussing long-term indications, as well as clinical scenarios for the common complications for the patients who are currently having destination therapeutics or bridge to transplant.
Phenomenal. Thank you so much for giving us a preview of the book, Dr. Louis. Dr. Louis, in terms of the book, I hear that there has been significant amount of content added, and I'm so excited to look through them and go through that material. I do have a question for you, though, is how does that affect the portability of the book?
That's a great question, Jessica. The text, I actually have it here, is 548 pages on the original text. You'll be surprised at 36 chapter revisions and 19 additional chapters for 91 total chapters. We've been able to make it exactly 548 pages. And I'll tell you a couple of things that we did to keep it portable and as a handbook. The original text is 5.5 by 8.5 inches. Our new text is 6 inches by 9 inches. So it's pretty much similar in size. In regards to the actual content on the inside, you'll see that the previous text, the actual size of the text, excuse all my writing, were such that, you know, it was about size 10 or so. And we're at about size 9 on the text, and we are a little bit up on the margin. So there's a significant addition of information per page, but it's still very legible. And otherwise, we're excited about how the finishing of this book has come out. We're excited about how the text has been complete.
I'm excited to get my hands on that as well to upgrade my first edition to the second. All right, thank you. And Dr. Watson, how can trainees obtain a copy of this excellent resource?
Great. As we've alluded to, Amazon Kindle is a repository for our textbooks. So there is the electronic version on Amazon Kindle that's available to trainees, as well as a paperback version that will be coming out shortly. Both of these will cost $60 a piece, and the money that the TSRA raises will go on to support other TSRA initiatives to further help trainees.
Thank you so much, Dr. Watson. And Dr. Louis, in addition to this excellent book, what other resources can cardiothoracic surgery trainees use and look forward to from the TSRA?
Well, cardiothoracic surgery trainees can depend on the Thoracic Surgery Residents Association to continue to build resources that have been instrumental in the training of cardiothoracic surgery residents. The TSRA essentially has been established since 1997 under the TSDA, and over the last 23 years, they've been able to expand the needs of the members by providing these peer-based resources and successfully launching their careers. Some of the things that we're working on right now our YouTube channel. So we'll be putting out content every so often from our webinars and other areas so that individuals can go on our YouTube channel and get some educational materials there. We're currently working on our next installment of the TSRA review textbook. So we'll be doing our 3rd edition. The lead editor for that one is going to be Dr. Brescia from University of Michigan. So we're actually doing a call to review authorship from different individuals who are interested in having a chapter in that text. Again, as I mentioned earlier, we're doing a lot of webinars. For instance, we're having webinar journal clubs that will be happening this year, where we'll be having experts discussing their therapeutics, cardiothoracic surgery, pioneers who will be discussing and or mentioning the different opportunities for treating different cardiothoracic surgery pathology. So that'll be pretty interesting. We're also working on updating our multiple choice question bank. We have a repository of about 600 questions. This was created during the time of the TSRA review, the original first edition, but we've been updating those questions very often. And as individuals get access to those questions, which by the way is a free resource, using their commentary or otherwise, we're actually updating the questions. We're talking to experts on our end as well. And this free resource is available to anybody, both internationals and national individuals who would like to continue to increase their knowledge as it pertains to cardiothoracic surgery. So those are some of the things that we're doing. We also have some scholarships, the Global Health Scholarship and the Traveling Scholarship, which both have deadlines sometime late December.
Well, thank you so much both for joining me today to speak about the new TSRA Clinical Scenarios in Cardiothoracic Surgery Second Edition book. And special thanks to all contributors for making this resource possible. Make sure to check out all the other fantastic resources available to cardiothoracic surgery residents on the TSRA webpage, and subscribe to our YouTube channel and social media to stay up to date with all the latest TSRA news, and check out Amazon to get your own copy of this new book. Thank you very much, everyone.
Thank you.
Thank you.